Hi, let's talk today about cell adaptation. Any changes in stress, increase or decrease results in adaptation. First of all, let's talk about the increase in stress adaptation. There are two types, hypertrophy or the increase in cell size and hyperplasia or the increase in cellular number. In case of hypertrophy, any increase in stresses results in the increase of workload or it increases the size, and then in order to maintain homeostasis the genes are first activated, protein synthesis increases, and then production of organelles takes place, which results finally in hypertrophy. Normally, due to increased stress, both hypertrophy as well as hyperplasia they occur simultaneously. Example, the increased size of the uterus during pregnancy. First of all, the smooth muscles they undergo hyperplasia and then hypertrophy takes place. We have an exception. Always remember that permanent tissues they do not undergo hyperplasia as they have lost the ability to divide. Examples of permanent tissues are cardiac muscles, skeletal muscles, and nervous tissues. Okay, let's step back. Adaptations can be either pathologic or physiological. Pathologic hyperplasia can progress to dysplasia, which can further result to cancer. Example is endometrial hyperplasia, which occurs due to the increased estrogen exposure. Always remember that the endometrium grows in exposure to estrogen, whereas the endometrium sheds off in exposure to progesterone. We have an exception to this concept, benign prostatic hyperplasia. Now, we will discuss about decrease in stress adaptations, atrophy, which results in decreased or size of the organ. We have two mechanisms of atrophy. Firstly is the ubiquitin proteasome degradation pathway. Ubiquitin is a protein which gets posted onto the intermediate filaments of the cytoskeleton, whereas proteasome is an organelle which recognizes ubiquitin tagged protein and destroys them. The second mechanism is autophagy of cellular compounds or components. Autophagy is also known as the self-consumption process in which vacuoles are formed which gets bound to the lysosomes, and then self-consumptions take place. Changes in stress leads to change in cell type or metaplasia. Metaplasia commonly involves surface epithelium. Okay, let us recall that there are three types of epithelium: squamous epithelium, which can be stratified or non-stratified, columnar epithelium, and transitional epithelium or uroepithelium, also known as urothelium. Metaplasia occurs because metaplastic cells are better in adaptation. Barrett esophagus is a classical example of metaplasia. Here we have the stomach. The distal part of the esophagus is lined with squamous epithelium, whereas the stomach is lined with the columnar epithelium. Both the epithelia are separated with the help of a sphincter. In most cases, due to prolonged acid reflux, reprogramming of stem cells of the distal part of the esophagus occurs, which results in the formation of mucinous columnar non-ciliated epithelium. Metaplasia is reversible. It can also lead to cancer. We have an exception to it. Apocrine metaplasia or the fibrocystic changes of the breast tissue has no risk of cancer. Vitamin A deficiency can also lead to cancer, as it is required for maintenance of certain epithelia such as the conjunctiva. Mesenchymal cells can undergo metaplasia. Mesenchymal cells such as bone, blood vessels, fats, and cartilages. Any example is myositis ossificans. Here, any inflammation due to trauma of the smooth muscles get converted into bones. Dysplasia is the disordered cellular growth which refers to the proliferation of precancerous cells. Example is the cervical intraepithelial neoplasia, which can arise due to long standing of the pathological hyperplasia such as endometrial hyperplasia or metaplasia as seen in Barrett's esophagus. This process is also reversible with the elevation of the inciting stress. It can also be irreversible if progresses to carcinoma. This is the major difference between cancer and dysplasia. Aplasia refers to the failure of cell production during embryogenesis. Example is unilateral renal agenesis. And lastly, hypoplasia is the decrease in cell production during embryogenesis. Example is streak ovary in Turner syndrome. Well, that's all. Thanks for watching.